invited guests, media team participants, ladies and gentlemen. It's an honor and a privilege, and it's a very humbling experience to be invited to officiate in the opening of this National Nursing Symposium. And I thank you for the invite. I hope you're hearing me from the back. No. Maybe I need to talk louder. Okay. I am told around about end of last year and also the beginning of the year when Margaret came and said we need to get this symposium up and running. And she said it's the 5th one. And I said, Margaret, one thing that I do know is one of the best conferences that I've ever been to and I spoke in was the Attorney General's Lawyers Conference, where the Honorable Attorney General actually took charge and organized a conference to bring lawyers together. And I said to Margaret, you know what? I would be very, very, very proud if we can make this the Ministers for Health Conference. Not the doctors one, not the health inspectors one, not the physiotherapist one or the radiographers one, but the nurses one. And so that is the reason for the change in the name. And the change of the name is to actually show that not only I, but the Ministry of Health, but also government supports nursing and is in tune with the growth and the momentum and the interest in nursing. And we are very keen to continue to support that interest and momentum in nursing. One thing that is very clear to me is that I was born in Suba in the old Anderson maternity unit. Also, one thing that is very clear to me is that the first face that I saw was that of a nurse. And then one thing that was also very clear, and I hope that one day the last face that I'll see before I go will be that of a nurse. I hope my wife is not listening. But that is the importance of the nurse. The nurse is there before the baby is born. The nurse is there when the baby is born. And the nurse is there throughout the growth of the child. We had a look at all the encounters that we in the Ministry of Health have and medical services with a child from the time of inception or conception to when they are 19 and leaving school. And we realized even before, even if you take away the sickness and the falls and the injuries, there were 55 mandated encounters. 55. From the time of conception till when they leave school. 55. And majority of the 55 is nurse-led. Majority. Maybe 50. Maybe more than that. And being here today and having 270 registered participants, it signifies not only the quantity but the quality of what we are trying to achieve. Because nurses play a very important role in the development of the nation and the development of individuals like me who make up the nation. So I acknowledge the foresight of the Fijian Nursing Council in being the initiator and organizer of the symposiums for the last 5 years. This symposium also allows you to gain your 20 continuous professional development points for your annual practicing license. And this is something that is very important because we live in an age where it is unacceptable to be without CPD points that are mandated by the Council. The strength of the Ministry of Health depends on the strength of the institutions within the Ministry of Health. The Nursing Council, the Medical Council are independent institutions. And it is therefore very vital that they are established by an act, that they are independent, that we adhere to that independence, and we adhere to the mandated requirements of the councils. The theme of the symposium this year is appropriate for the nursing fraternity and certainly for the bigger health family. The need for call for nursing in Fiji to explore and pursue new tangible horizons is a priority that cannot be overemphasized. We need to be thinking beyond. We need to be thinking about multitasking. We need to be thinking about a change, and a change for the better. I was in Raki and Tavo yesterday, and we were talking about how we can effectively use the community health workers. One of the zone nurses said to me, he said, sir, one of the issues that I have is I find it difficult sometimes to go and visit and do my domiciliary visit. And I said, what about the village health worker? Do they live close to the patients that you have to go and visit? Oh yes, sir, they live very, very close. And I said, why is it that we cannot use the community health worker to do your domiciliary health visit? She said, but it's always been that way, that I have to make time in a week to go and visit these patients that are lying at home. And I suggested to her and to the subdivision health seat, and I said, this is the time to make the change that's relevant in the horizons that we are beginning to pursue. I said, you know, I was a registrar in surgery for about 9 years. I was awake, I was like a zombie sometimes because I was in hospital most of the time. And I reached a stage where I finally did all my exams and got my registration. I was told, you're now a consultant. So I didn't have to sleep in the hospital. I slept at home. Somebody called me and I then came in. And I said to this zone nurse, and I said, maybe it's time for you to start acting like a consultant. Let the village health worker utilize her payment to be able to contact you if she has some issues around domiciliary visit. And that is just telling you about the changes that we need to make. And at this time, it is you at the forefront. It is you at the coalface. It is you that needs to make the change. I have walked the breadth of this nation in visiting our facilities. We have 207 facilities. And I've heard, when I've asked particular questions, and I've heard answers such as, but that was how it was done. I'm now, as your Minister for Health, inviting you to leave your lasting legacy, to make the appropriate change that will encourage us to achieve our progress towards universal health coverage. And universal health coverage is based on three important pillars. Number one is we are leaving no one behind. Number two, we are reaching the unreached. And number three, we are reducing the out-of-pocket expenses so that we encourage the population to utilize our service. The evolving population health needs, the new emerging diseases, the re-emergence of once gone public health issues, and the public's changing profiles, they provide us with substantial evidence to support the need for all healthcare professionals, and especially nurses, to explore the best strategies to meet and address these growing demands. I'm very interested in your continuing professional development. I believe that since we have 5,500 staff, we have another added 1,340 or something with the village health workers, that this ministry needs to continue to develop its staff. You are the most important resource of the Ministry of Health. And I'm also very keen that we continue to explore ways not only to enrich us with education around nursing, but professional development, so that nurses can begin to chart into territories that they've never been to before. And I think that challenge is on us being able to solidify continuing professional development. About a decade ago, with medical education, it changed from continuing medical education to continuing professional development, about 20 years ago. We struggled with it as doctors, because whenever we came to have a conference, it was all about the science. And then we realized that what it was wanting us to do was to develop as a professional. How do you respond to adversity? How do you communicate with a colleague? How do you deal with a colleague that is not behaving? And so the development around continuing professional development in this nation needs to continue, so that we are not only nurses and doctors, we are true professionals in the word of it. Research is very, very important. I've had the pleasure, and one of the best jobs I've ever had was working in the medical school for about 4 years. And the nursing school or the medical school, there's a very strong emphasis on research. I can tell you, I didn't really like doing research, because it meant that you had to sit down, it meant that you had to read a lot, it meant that you had to make proposals, but I enjoyed it. I realized it was a very important component in being able to enrich us. Most of you in this room here have achieved at least your primary target of a qualification. What will make you stronger and better is research. The improvement in patient care through soft skills such as compassion, kind-heartedness, loving, being committed, dedicated, and being professional is also very, very important. I know in the medical school and in the nursing school, we talk about what we say graduate outcomes. Who do we want, or what type of professionals that we want? I realized after reading a lot that the best way to be able to show compassion, to teach compassion, was to show compassion. The best way to be able to teach commitment was to show commitment. The best way to teach professionalism was to show professionalism. And I encourage you today, as you work in the wards, as you work as a scrub nurse in theater, as you run programs, to be able to show that to the next cadre of nurses that are coming through, and the many, many, many student nurses that come and are attached to you in the work that you do. I've also been asked to continue to remind us about having a valid practicing license. I cannot overemphasize that. I also have to make sure I have a valid practicing license. I want to finish by again saying that we have moved towards universal health coverage. And I want to bring that concept down to an example. The example is this. My island that I come from is Moala. If a patient had a breast lump, which is probably a cancer, in Moala, and we had a similar patient with probably a breast lump, looks like a cancer, in Extension Street beside the hospital, Can we put our right hand over our heart and say that they both will receive treatment at the same time? That they both will be looked after well? Because if the answer is no, then we really need to pursue universal health coverage. Because universal health coverage is about ensuring equity and access. And one thing that I've realized is that often it is us in the Ministry of Health that are often the gatekeepers to people receiving good health care. And I challenge you today that when you leave this conference, you will think in your mind how best you can be able to progress and pursue universal health coverage wherever you are. Because it is in the betterment of our people. And remember the 3 pillars that I've talked about today: reaching the unreached, leaving no one behind, and reducing the out-of-pocket expenses so that we can encourage people to be able to utilize the service. I've really enjoyed this morning coming here and speaking to you. I wish I could go around the room and shake everybody's hand. I know that's impossible, but I want to end this speech by saying that we value you as nurses. The government values you as nurses. The budget that was called last week on Friday, you may have heard that our Minister of Health budget has an increase, and some of those increases are around ensuring that we have a very strong, steady, and very proficient workforce. And that actually continues to show that government values you and the contributions that you make. Yesterday in the evening, I was with the Honorable Prime Minister, and he looked at me and he said, we should be having a meeting tomorrow. Now, we're having a meeting now. And I looked at him and I said, sir, I've got to open the Nursing Symposium. He turned around and he said, you better do that, that's important. And when you finish, then you come to the meeting. So I was very, very proud because I'm the junior boy. And I mentioned that I was opening the symposium and I was allowed. That shows to you that the Honorable Prime Minister also has you in his thoughts. So thank you. God bless you. Enjoy yourselves. So with those few words, thank you very much. God bless you.